Welcome to Full Measure. I'm Sharyl Attkisson. In the past 3 years, the Affordable Care Act, or Obamacare, has expanded free health insurance to millions of low-income Americans and is helping pay the cost for millions more at taxpayer expense. But it's no secret that for many others, premiums have skyrocketed, benefits have declined, and they've lost their doctors. Just this week, the Obama administration revealed premiums will rise an average of 22% next year. In Arizona, the cost of some plans will increase 116%. With enrollment for 2017 beginning on Tuesday, we investigated and found that Obamacare is in critical condition, leaving a dire outlook for the nation's health insurance system.
Virginia health insurance broker Ed O'Brien helps match up customers with the right policies.
It's not working. Clearly, it's not working.
A task that's become much tougher, he says, under Obamacare.
Your average person who makes $30,000, $35,000 a year cannot afford a $10,000 deductible and an out-of-pocket that's even higher than that. It's simply not sustainable or affordable.
Kara Acorn says Obamacare has been especially hard on her mother, who wasn't offered insurance at work.
She personally had to purchase her own plan through insurance, through Obamacare, and she had diabetes and some other health care concerns, and her plan was just, she could barely afford it. It was so unaffordable. They call it the Affordable Care Act, but it was actually the opposite for her.
You know what? I told them not to call this the Affordable Care Act.
You told who?
The Obama administration, the Democrats, every Democrat I could find.
Robert Leshevsky is a policy advisor and analyst for the insurance industry. He's correctly predicted Obamacare's pitfalls since day one.
The future is not good. The fundamental problem is not enough healthy people have signed up to pay for the sick, and not enough healthy people have signed up because the insurance plans that people are being offered just simply aren't of good value.
What do customers see as wrong with the insurance product?
The insurance products that consumers see are still too expensive in terms of premium, and the deductibles and copays are too high.
Can you explain in simple terms how the insurance companies are losing so much money if they're charging so much for premiums and if deductibles are so high?
It's real simple. If you only provide a health insurance plan that the sickest people buy, you can't charge enough. You can never charge enough.
The rates are getting such that people are saying, I'm just simply not going to have health insurance and I'll pay the penalty because I just simply can't afford the premiums, and I'll take my chances of being uninsured and paying the penalty, which defeats the purpose of the Affordable Health Care Act.
Lena Simmons says she's lucky to have good insurance through her teaching job. She knows others facing a hard reality.
If you're working for a city job, you have health care. But if you're working for a job in a pizza place or a retail center, it's expensive for them to give you quality health care.
It's expensive, say experts, because nearly all of the government's plans to increase competition have backfired. Take the abysmal failure of the Obamacare co-ops. 23 nonprofits started up with your tax dollars. After sometimes paying exorbitant salaries to their executives, they've gone belly up one by one.
There were 23 and 17 have gone broke so far.
And that's our tax money that went down the tubes.
About $3 billion when it's all over, yeah.
For-profit insurance companies are jumping ship too.
Like Aetna, Humana, United Healthcare, some Blue Cross plans pulling back, a number of Blue Cross plans losing substantial amounts of money and having to go after major rate increases to stay in the business.
Earlier this month, Obamacare critics were surprised to hear agreement from an unlikely source, President Clinton on the stump for Hillary.
So you've got this crazy system where all of a sudden 25 million more people have health care, and then the people are out there busting it sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world.
The White House declined our interview request. Last week, the president acknowledged Obamacare's troubles, but said his signature health care plan can be fixed instead of scrapped, like a smartphone that was recently recalled for catching on fire.
And think about it. When one of these companies comes out with a new smartphone, then it has a few bugs, what do? They fix it. They upgrade it. Unless it catches fire, then they pull it off the market.
But the president continues to call the Affordable Care Act one of his administration's key successes.
Because of Obamacare, another 20 million Americans now know the financial security of health insurance. So do another 3 million children. And the net result is that never in American history has the uninsured rate been lower than it is today.
Is it true that more people have health insurance today as a result of the Obamacare plans?
It is true that more people have health insurance today because of Obamacare, particularly because of the Medicaid expansion in the 31 states that have taken it.
Richard Fuertes says he's delighted by the options available in the U.S. compared to where he comes from in the Philippines.
I really to be thankful and appreciate it for me, for myself.
Obamacare has also opened up affordable insurance to many with pre-existing medical conditions, illnesses that once made it impossible for some to get affordable insurance.
A lot of people were able to get insurance that couldn't get it before because they had pre-existing conditions. I suppose in some respects that was a good thing. Unfortunately, these pre-existing conditions, which aren't looked at any longer, have caused insurance rates to go up, at catastrophic rates.
In the insurance industry, it's called the death spiral. Not enough healthy people sign up to pay for the sick. Premiums have to go up, so more healthy people drop their insurance. Premiums for those left have to go up again.
The lowest income people in Obamacare are the ones that benefit the most. They get the highest subsidies, and their deductibles and their copays get subsidized. So if you look at the very lowest income people in Obamacare, 82% of them have signed up. That's terrific. That's a terrific pool. But then if you look at the people between 300% and 400% of poverty, the people that start moving up toward middle incomes as a comparison, only 17% of them have signed up. So I think part of this program is in a death spiral already.
Earlier this month, Minnesota Governor Mark Dayton, a Democrat, backed off his staunch support of Obamacare after sticker shock cases, like one family of four learning they'll have to pay $40,000 in premiums next year with a $13,000 deductible.
Ultimately, I'm not trying to pass the buck here, but the reality is the Affordable Care Act is no longer affordable.
At its core, it was supposed to provide affordable insurance for everybody who needed it.
Yes. The Affordable Care Act was supposed to ensure that whether you were employed or unemployed or self-employed, you would have access to affordable health insurance. For someone who's not getting a subsidy, who's paying the full cost of insurance, it's likely that they're now paying about double what they paid before, under the old market where only healthy people could get in.
Anytime you make a law that forces someone to spend their hard-earned money on something, it gets pretty tough. We're just not I think as a whole country, we're just not in a place where we can be told we have to spend that many hundreds and hundreds each month, especially if you have multiple people in your family. It's a huge sacrifice.
Leshevsky and other experts say Obamacare is already a failed experiment and predict that without a major fix, it will implode by the end of next year.